Hello and welcome to Audio Medical Basics, where I read medical books to your ears when your hands are too busy to hold a book. If you like, please don't forget to like, share, and subscribe. So, today we'll continue with our second title, our second symptom from the Signs and Symptoms book. We finished the last time the abdominal distension. Next comes abdominal mass. As mentioned, this book will go alphabetically. It will speak about everything related to the specific sign or symptom. So let's start. Abdominal mass. Commonly detected on routine physical examination, an abdominal mass is a localized swelling in one abdominal quadrant. Typically, this sign develops insidiously and may represent an enlarged organ, a neoplasm, an abscess, a vascular defect, or a fecal mass. Distinguishing an abdominal mass from a normal structure requires a skillful palpation. At times, palpation must be repeated with the patient in a different position or performed by a second examiner to verify initial findings. A palpable abdominal mass is an important clinical sign and usually represents a serious and perhaps life-threatening disorder. Next, we have emergency interventions in case of abdominal mass and emergency settings. If the patient has a pulsating mid-abdominal mass and severe abdominal or back pain, suspect an aortic aneurysm. Quickly take his vital signs. Because the patient may require emergency surgery, withhold food or fluids until he is examined. Prepare to administer oxygen and to start IV infusion for fluid and blood replacement. Obtain routine preoperative tests and prepare the patient for angiography. Frequently monitor blood pressure, pulse, respiration, and urine output in this patient. Be alert for signs of shock such as tachycardia, hypotension, and cool clammy skin, which may indicate significant blood loss. History and physical examination of an abdominal mass. If the patient's abdominal mass doesn't suggest an aortic aneurysm, continue with a detailed history. Ask the patient if the mass is painful. If so, ask if the pain is constant or if it occurs only on palpation. So, if constant or only on palpation, is it localized or generalized? Determine if the patient was already aware of the mass. If he was, find out if he noticed any change in the size or location of the mass. Next, review the patient's medical history, paying special attention to gastrointestinal disorders. Ask the patient about gastrointestinal symptoms such as constipation, diarrhea, rectal bleeding, abnormally colored stools, and vomiting. Has the patient noticed a change in his appetite? If the patient is female, ask whether her menstrual cycles are regular and when the first day of her last menstrual period was. A complete physical examination should be performed. Next, auscultate for bowel sounds in each quadrant. Listen for bruits or friction rubs and check for enlarged veins. Lightly palpate and then deeply palpate the abdomen, assessing any painful or suspicious areas last. Note the patient's position when you locate the mass. Some masses can be detected only with the patient in a supine position. Others require a side-lying position. Estimate the size of the mass in centimeters. Determine its shape. Is it round or sausage shaped? Describe its contour as smooth, rough, sharply defined, nodular, or irregular. Determine the consistency of the mass. Is it doughy, soft, solid, or hard? Also, percuss the mass. Percuss the mass. A dull sound indicates a fluid-filled mass. A tympanic sound indicates an air-filled mass. So in percussion, dull sound indicates a fluid-filled mass, and a tympanic sound indicates an air-filled mass. Next, determine if the mass moves with your hand or in response to respiration. Is the mass free floating or attached to intra-abdominal structures? To determine whether the mass is located in the abdominal wall or the abdominal cavity, ask the patient to lift his head and shoulders off the examination table, thereby contracting his abdominal muscles. While these muscles are contracted, try to palpate the mass. If you can, the mass is in the abdominal wall. If you cannot, the mass is within the abdominal cavity. So next here we have a table where the abdomen is divided into quadrants. Right upper quadrant, left upper quadrant, right lower quadrant, left lower quadrant. And the differential diagnoses are mentioned, each depending on the quadrant. I will put the table here. See, this is the picture. And these are the possible things here also in the lower quadrant of each. So I'll be reading this quickly. Abdominal masses, locations, and common causes. The location of abdominal mass provides an important clue to the causative disorder. Here are the disorders most commonly responsible for abdominal masses in each of the 4 abdominal quadrants. So we'll start with the right upper quadrant. Put your hand on your right upper quadrant and say with me: aortic aneurysm in the epigastric area, cholecystitis or cholelithiasis, gallbladder, gastric or hepatic carcinoma, hepatomegaly, hernia, incisional or umbilical, hydronephrosis, pancreatic abscess or pseudocysts, renal cell carcinoma. That was in the right upper quadrant. Now the left upper quadrant, put your hand if you can on the left upper quadrant. It's okay, only to remember the disease, don't worry. Aortic aneurysm in the epigastric area, gastric carcinoma, epigastric area, hernia, incisional or umbilical, hydronephrosis, pancreatic abscess in the epigastric area, pancreatic pseudocysts, epigastric area, renal cell carcinoma, and splenomegaly. That was the left upper quadrant. Now, put your hand on the right lower quadrant. Don't worry, don't be superstitious. We're just remembering the names. Right lower quadrant, bladder distension in the suprapubic area, colon cancer, Crohn's disease, hernia, incisional or inguinal, ovarian cyst in the suprapubic area, uterine leiomyomas, also in the suprapubic area of the right lower quadrant. Now put your hand finally on the left lower quadrant. If you can, don't make an accident and blame it on me. Left lower quadrant, bladder distension in the suprapubic area, colon cancer, diverticulitis, hernia, incisional or inguinal, ovarian cyst, suprapubic area, uterine leiomyoma in the suprapubic area, and volvulus. Okay? Many things are repeated in each area, but there are some things which are area specific. For example, aortic aneurysm is specific for the left and right upper quadrants. Pancreatic abscess, specific to the left upper quadrant, epigastric area. The splenomegaly also, left upper quadrant. Crohn's disease, specific to the right lower quadrant. This is according to this table. I will not, it could be other, this is specific to the table I'm reading right now, okay? And diverticulitis, specific to the left lower quadrant. Of course, hernia is possible apparently in all quadrants. On physical examination. Okay, thank you so much for listening, and we'll continue in part 2 about the specific cases that cause abdominal mass sign. Thank you very much for listening. Please don't forget to like, subscribe, and share.